All right, with that, we're being recorded. This is Marilyn Rissmiller with the Colorado Medical Society again, and today's program is ICD-10, Start with a Plan. I'm sure that you all saw the late-breaking news last week from Health and Human Services indicating that there's a possible delay in the implementation of ICD-10. And up until last week, there were three things that I thought were fairly certain. That was death, taxes, and that there would be no delay in ICD-10. Well, I guess we need to stay tuned because the details are not yet available. And if you take a closer look at the actual announcement, which I'm sorry, this is a kind of a blurry slide. We'll have to put a link to this on the website. It might be a little clearer if you were to go to HHS's website. The headline is HHS announces intent to delay ICD-10 and note this compliance date. And Secretary Sebelius is quoted as, "We have heard from many in the provider community who have concerns about the administrative burdens they are facing in the years ahead. We are committing to work with the provider community to re-examine the pace at which HHS and the nation implement these important improvements to our healthcare system." So with that, we'll just need to see what that really means. The wording is unclear and can really be interpreted in a number of ways. In preparing for today's presentation, I looked at a number of project plans and timelines, and they all indicated that we should have started our preparation at least 1 year ago. So we can look at this potential delay as really a chance to catch up. But like I said, we'll be waiting for more information. And with that, I'm going to get ready to turn the presentation over to David Ginsberg. David Ginsberg is the president of Private Plan Associates and is a healthcare consultant. He's currently working very diligently with the Colorado Rural Health Centers to implement electronic health records into rural physicians' practices and help them to achieve meaningful use. David has also done a lot of consulting on HIPAA privacy. David is going to give us information on project planning. And so I will get ready to turn the program over to David.
Bearing with these technical challenges. So as Marilyn suggested, for many healthcare provider organizations, particularly small, mid-sized medical practices, the best practice probably would have been for you to start your ICD-10 project some time ago. And regardless of what the delay portends for providers, we're reasonably certain that the ICD-10 methodology is going to be implemented at least on the payer side, and that sooner or later you'll have to comply. And of course, it takes quite a bit of planning and preparation for the typical practice to be ready. Not many of you may have lived through ICD-9. I had the good fortune to do ICD-9 seminars in 1978 to probably about 1,000 physicians in California. So I can claim a little bit of bragging rights of having lived through ICD-9's implementation in the very beginning when we didn't even have a diagnosis coding system. And life is much more complicated today, largely because diagnosis codes are used so much more integrally in the revenue cycle process in terms of claims payment, claims submission, medical necessity checking, and so forth. So the preparation steps equally are that much more complicated. Preparation now obviously means to prepare a plan and a timeline. And as the slide suggests, it's not simply a technical project, nor can you merely rely upon your vendor to get you ready. In fact, that may be a very big mistake. Investment of time and effort now will hopefully allow for and create a very thorough, very thoughtful, and a smooth transition, and potentially avoid omissions and costly mistakes. And typically, what these tend to be is rejection of your claims when the effective date comes along, and or having to spend more funds than you thought you would, and not being prepared for ICD-10 because you don't have the budget for that. Therefore, preparation also means creating a budget, understanding through an evaluation what kind of costs you need for training, system upgrades, testing, potential revenue, and delays. Some of you out there may have already been told or found in the last year that in getting ready for ICD, or rather for 5010, you've had to upgrade your computer servers. Now, we don't expect the same problem with ICD-10, so if you upgraded for 5010, you may be okay. But then again, there may be some vendors that will require you to upgrade hardware, potentially, or do some costly software upgrades. Learning early what those costs will look like, having that in writing, will make your life a whole lot easier. The implementation plan has a variety of steps, and these steps fit within almost any kind of process that you might implement in your practice. So whether we're talking about electronic health record implementation, in this case ICD-10 preparation, typically we fall back upon some very age-old wisdom of how to develop a project plan and how to implement. There's the communication stage, there's the strategy stage, there's a readiness assessment. You need to find out where you are today to know how far you need to go to be ready. There is what we call the system analysis, or I like to call that the inventory stage. There's a training stage that requires quite a bit of planning. And just think about how much time all of you are giving to today's presentation. That's 1 hour, your lunch hour out of your lives. How many more of these hours will you need to spend over the course of the next many, many months until ICD-10 goes into effect? There is a documentation process and, of course, an important budget process. And we'll talk about each one of these throughout the day. The key in the first stage is communication. And that, I like to call that getting all the stakeholders involved. Now, any of you who have lived through an electronic health records implementation recently probably were guided, if you had good guidance or support, maybe from one of your regional extension center partners, that it's really important to get early stakeholder involvement. Stakeholders would be essentially anybody who is affected by the particular project. In the case of ICD-10, communication would be to communicate within the practice, your practice, to any stakeholder who's going to be affected by ICD-10. And you may even think, well, my front desk probably won't be affected, but certainly my medical assistant will be affected if they're helping with the super bills, my providers, my physicians are affected, my billing staff is affected. Maybe you have somebody that's working collections. Maybe you have somebody that's helping you with your revenue cycle. They're affected. Your clearinghouse is affected. So the first step is to achieve buy-in by figuring out who are the stakeholders who will be affected. And it's really important to build and identify champions early in this process to determine who is going to help you, if you will, push this rock up the hill. Because the ICD-10 rock, if you will, is a big rock like any others in your practices. If you look at how little time you have today in your busy schedules to add anything new into your practice, think about ICD-10 now coming along and requiring even more time. And by the way, that's on top of the time that those of you who are involved in electronic health records reaching meaningful use will have to give this year. You'll have to give in a year or two to stage 2. You'll have to give to every year to maintaining meaningful use. You'll have to give to HIPAA compliance because the HIPAA regulations are changing, and so forth. So you'll need to budget not just for cost, but to budget for time. And the first step to do that is to communicate to the stakeholders so everybody who's involved within the organization can be facilitated. They can participate and understand how much time they may have to give to this. It doesn't come as a surprise. This management strategy slide is really important because, of course, it talks about not only setting aside adequate time, which is easier said than done, obviously, but identifying personality styles. That may be easier said than done for most practices, but some of you know that you have multiple personality styles within your practice. You may have the follower and the leader, and you may have the person that just doesn't want to do anything. and wants it done for them. Look at that early. If you have physicians today, and I'm not trying to single out your physicians and blame them, but if you have physicians today in a paper-based system who still don't want to circle the right ICD-9 code and are resistant to giving you a higher level of specificity in ICD-9 when you ask for it, then those same physicians will be problematic in getting you to ICD-10, which vastly increases the number and options that you have for coding and the level of specificity. If you have issues at any point within your personality in terms of any kind of project planning, you may want to consider how you work around that in order to get the appropriate buy-in and appropriate support in the communication level and in the implementation of your ICD-10 project. Now, the next step is really creating an inventory or assessing your readiness. You don't really know where you have to go until you know where you are, per se, and that's how we characterize this particular slide right now. ICD-10 is no different than any other project. Who is using ICD-9 codes right now? Because they will be affected on a staff level. Obviously, the physicians are quite involved because they'll be using it, and as most of you transition, if not many of you, into electronic health records, you'll be finding that you're moving away from simply circling an ICD-9, which you do today in a super bill. With the implementation of the EHR, you're moving into a drop-down box where you may enter a code and choose from thousands of codes. You'll want to carefully investigate how your software helps you do that in the most accurate level, whether you can create what we like to call favorite lists or pick lists of the most highly used codes and so forth. So that's why we say don't forget the physicians. Don't forget your provider community that will be actually selecting the codes during the encounter, because for most of you, you do not necessarily have, nor can you afford, a certified coder in the back office to all day long, like they do at hospitals, simply choose the ICD-9 codes based upon the note, or in this case, the ICD-10 codes. What about your systems? Your information systems, and really this is your billing software, your electronic health record system. Will any upgrades be necessary? Will there be new software? Will that new software require new hardware, as we just discussed? Many, many practices had rude awakenings to get ready for the 5010 HIPAA standard transaction type by being required, if they were using older systems, to upgrade to what are called 64-bit Windows servers. They were not inexpensive, and it took time to get that in place because the older servers just couldn't handle the software upgrades that were coming along for 5010. Will there be new documents, new order forms, coding tools? Do you need books, ICD-10 books? Do you need to upgrade your documentation and so forth? Inventory all the places today that you currently use or disclose. You use or you exchange and create an ICD-9 code, because every one of those areas is typically one that might be affected by ICD-10. And remember, within some of these areas, there'll be multiple areas. So, for example, your claim that you generate will have an ICD-10 code going forward once it becomes effective. So that's one area that you're inventorying. But that ICD-10 code is chosen and selected as part of your revenue cycle software, your practice management or your EHR system. And in turn, there may be other systems that come back. For example, your electronic remittance advice, depending on the payer, might come back and they may show you the ICD-10 code that you submitted, especially if they're telling you that that code does not match the service. So now you have yet another place to inventory where you may be encountering or coming across an ICD-10 code. So the inventory is a matter of identifying your staff and stakeholders and identifying where you use ICD-10 codes and not forgetting what we like to call trading partners. Remember, the third-party payers to whom you submit your claims are obviously your largest trading partner with whom an ICD-10 code gets exchanged or will get exchanged, and today with whom an ICD-9 code gets exchanged. Clearinghouses are also an important trading partner. With the new 5010 standard, as you know, you can now include more diagnosis codes per claim. You want to be sure with the ICD-10 code that your clearinghouse is equally ready to not only include everything you submit and report to them out of your system, but also to not drop any trailing decimals or digits or numbers that they need to have tested their systems thoroughly. And of course, that brings you back to the vendor. The vendor's importance in this process is critical. If you have a vendor who today is not generating what we call a HIPAA standard transaction, still today, even after 5010 has gone into effect, and is still generating a print image of your claim that the clearinghouse then uses to convert to a HIPAA electronic format, you'll need to have that remedied by time ICD-10 goes into effect, because they may not be able to possibly configure their systems to have as many codes, ICD-10 codes, as the 5010 standard supports and allows in the new transaction type. So you'll really want to be sure your clearinghouses are ready, but more importantly, does your vendor generate a HIPAA standard transaction claim? We know many vendors still do not, and my response to them is shame on them for not being ready at this point. They've had many, many years. Please look into having systems, only systems, that generate HIPAA compliant transactions. And that isn't just me speaking, that's the American Medical Association cautioning physicians across the country to be ready at that level. Okay, you've done an inventory. You've talked about stakeholders in your project plan. What about the systems analysis? Well, this takes it a little deeper in terms of the workflow. Who is using an ICD-9 either electronically or manually? And how will that necessarily need to be modified from a workflow standpoint? Front desk, registration, scheduling, billing, super bills, claims submission, all these areas have people and workflows where an ICD-9 may be used today and an ICD-10 will be used in the future. And again, I hate to keep drumming on the same drum, but if you're undergoing an electronic health records conversion simultaneously with ICD-10 being implemented, then you're going to see over time quite a few workflows that are going to be changing in terms of how you currently select a code, ICD-9 code, and how you might be doing it in the future. Other considerations: do you need to buy encoding software or books? You may still need to maintain ICD-9 for some payers. Now, this is going to be tricky. We wonder what that delay that Marilyn talked about in the beginning really is going to mean, because the delay is likely going to be for providers, not necessarily payers. So the payers are ready and are enforced to be ready by October of 2013. They may say, send us either ICD-10 or ICD-9. You may find that payers that are still allowing ICD-10, because the provider community is still allowed ICD-10, you may find a very typical scenario occur where those claims take longer to process than the ICD-10 claims, just like in the past when we had practices that were submitting electronically versus practices submitting in paper. The practices submitting electronically found their claims were edited more quickly, and with fewer edits than those paper claims. So what other considerations is your systems analysis? Well, can your vendor also handle both ICD-9 and 10? At this point, this is a question everybody should be asking their vendor. What is their process for handling 9 and 10? You would hope that they're going to allow you to be detailed in your setup files to be able to say by insurance carrier, and not just insurance carrier, but even insurance company, because remember, you might have multiple Aetnas or multiple Blue Crosses, and some of the Blue Crosses might simply be an ASO that pays for a self-insured group employer, and perhaps that group employer for some reason says, we're going to stay in ICD-9, but Blue Cross Blue Shield General, your Anthem providers for your HMO and your point of services normal are going to say, no, we need ICD-10. Well, you can't just go in by insurance carrier. You have to go in by your insurance company file where you have a number. It may be, by the way, that by time ICD-10 is here and in place, the National Health Payer Identification System will also be in place, and we will have very specific numbers to enumerate every single payer, we hope every PPO in the country. And that might make this easier. But then consider from your systems analysis how much time and effort you'll have to spend going into your software to upgrade and those setup files to properly define This particular payer and company will be ICD-9 until such and such date of service, and this won't. You may even need to be able to drop that down even further in terms of a by patient setting. Will there be any quality measurement changes? Well, certainly PQRS, which is heavily driven by ICD codes within your software today, will change dramatically as it gets driven by ICD-10 codes. Potentially your practice reports. If you like to run reports today looking at specific diagnoses for any kind of financial or quality assurance programs, that's going to change as you migrate into ICD-10. Physician profiling, HEDIS reporting, even the immunization registry potentially, or any other kind of surveillance reporting, as time goes by, and we expect by time ICD-10 is in place, the state will have some form of syndromic surveillance in place so that your electronic health records can report any kind of healthcare syndromes electronically, which, by the way, is one of the meaningful use menu set measures, or objectives rather, that by that time you'll then have to shift to ICD-10 and let ICD-10 be the code format that is submitting or sending out that syndromic measure. So what about training? Okay, we're going through each of those steps now before we turn the slides over to Sandra and her next step. Awareness and training, you got to start now. The first step of training is to raise awareness. So you'll do that in your communication strategy in facilitating the stakeholders. You may need some very intensive coder training, but this is tricky. You want your coders to get trained soon, depending on when the official date is, but not too soon, because you don't want them to forget all that information and waste the cost or the training cost until they'll be kind of a difficult process here. And there's tricks in doing the training of identifying areas of weakness, knowledge, what your specialty is, and so forth. Assessing your educational needs and defining not only who needs to be educated, but what kind of education. For some of you, it may be sufficient to simply do this online. For others, maybe just reading the ICD-10 books. In other cases, you may decide, we're going to get our most bang for the buck if we go to a weekend seminar or a couple weekly seminars where we get intensive training on ICD-10. And you may decide that you want to do that through your specialty societies, etc., if they're offering something that's maybe a little more unique to your particular specialty. Then compare the relevant chapters between the two different books, if you will. ICD-10 is much different than ICD-9. It's structured differently. You're really going to have to get a little more practice and more accustomed to how the new codes are set up and structured within ICD-10. Be aware that your documentation is going to be improved and changed overall in how you chart and how you record by simply selecting ICD-10, because it is a far more specific form of documentation of diagnoses. Okay, developing a budget. This is a big one. This should not scare anybody away. MGMA's estimating a $84,000 cost. If you've got 10 providers, that's $285,000. 100 providers, $2.7 million. For some of you, may just scream and go, I can't even think of that. That's too much money. Whether it's $84,000 or not, let's simply say it's going to cost you money. It's going to cost you money either directly. The direct cost may be software upgrades. The direct cost may be buying ICD-9 or ICD-10 training. And definitely it's going to cost you mostly an indirect cost. The indirect cost could be a loss of productivity in the time it takes you to get trained and get ready for ICD-10 when you're not able to do other chores and other office tasks, etc. So developing a budget is critical. This is a typical budget breakdown. A good way the MGMA came up with this, what's the analysis time? And they just went and said, how much time does it take our staff to do this process analysis? What about changes to super bills? Do we have to do any IT costs? So today, it's probably not too early, especially for those of you who've already selected and implemented an electronic health record, get in writing from the vendor their assurance of the following. I firmly believe that no EHR vendor worth their salt should even dream of charging you for ICD-10. That is part of your regular annual maintenance, because ICD-10 is mandated by federal statute. It is not something you want. It's required by statute. Therefore, under their regulatory provisions, most vendors do provide you in your annual maintenance contract that they will keep your software up to date for 5010, ICD-10, and so forth. But please confirm that. Get that in writing from them so you know what to expect. determine if you have any other IT costs. Increased documentation, well, will it cost you this much time and money to increase the level of your documentation? If you're using electronic health record, it shouldn't. If you're using manual systems, it may take more time. It all depends on how much time in your specialty it's going to take. In a single specialty that's very narrow, you may be able to focus down the ICD-10 diagnosis codes to a small subset, just like you have done today in ICD-9. Unfortunately, the most fragile and vulnerable of our physicians, the primary care, and I say that because they are the ones typically that have the greatest volume with the lowest revenue sources, you will probably have the biggest challenge in documentation because you will be challenged to select from a wider variety and number of ICD-10 codes. And of course, MGMA in this budget said there will be cash flow disruption of up to $20,000. That's a purely subjective number. It could be $5,000. With good planning, it could be almost nothing. Or if the payers aren't ready, it could be horrendous, and that may be something you can't even plan for. So cost breakdown, your company, here's just some more information about trying to determine what are the impacts on productivity. How do you more specifically identify the budgetary costs? Do you need consulting support and other support like that? Again, we want to enforce, talk to your payers about what their ICD-10 implementation plan will look like. Be prepared for some potential cash flow delays and knowing what those workflows are going to be. Now, at this point, I'll turn it over to Sandy. And she's going to talk about creating a timeline.
All right. Thank you, David, for that good presentation. Now Sandy is going to build on some of David's slides and get into more detail on developing the timeline associated with this. So Sandy?
Thank you, Marilyn. I serve in my role with CHIMA as the chairperson of the Physician Practice Committee, and I also serve as a member of the ICD-10 task force. And in Colorado, I would have to say that we have a very active ICD-10 task force, and it's open. The meetings are open to anyone who would like to join us. We meet down at the Colorado Hospital Association, so you can contact Marilyn if you would want any further information about that. So let's go ahead and get started today. Well, as David said, we want to create a timeline and a project outline. We, of course, want to keep it simple. We want to keep coming back to it, and we want to try to have it visual. I'm a very visual person, so I would suggest, as we put in the slide, put it in the lunchroom or somewhere that people can see it. And then we should be assigning with our timeline specific tasks, who is responsible, and then deadlines, and then making sure that these folks are following up and having frequent meetings in order to ensure that this process is moving forward. We're going to talk in just a few minutes if you're thinking, oh my word, I have no idea how to even start my timeline. We actually have some templates for you, and Marilyn will have those out on the website and out on the Colorado Medical Society website, and you'll have lots of good links. So the AMA has a great timeline out there, so we want to talk about that. So what do you want to do then with your timeline? Well, of course, we want to start with the end date in mind. And yes, we all are aware that HHS and AHIMA and everyone, they were kind of dialoguing back and forth last week, and we were all getting lots of emails. But the bottom line is, I look at this as, okay, we may have been given a little bit of grace here, and we need to go ahead and get our timeline in place. If we have not started some of these things that I'm going to talk about, you definitely want to try to catch up. And if you haven't thought that ICD-10 would affect you, or some folks we hear say, oh, the vendor's got it all taken care of, don't be so sure of that. As David has already talked about, there's going to be an impact to your clinic. So we want to make sure that each individual practice is moving forward as it is. CMS indicated that being Centers for Medicare and Medicaid Services, that we should have begun the planning practice back in January of 2011. So this potential delay is going to just allow us the time to catch up. So it's one of those things, don't procrastinate here. And we're going to want to make sure that we have detailed description of the action plans and so forth across our practice. And each practice is going to be just slightly different. So a couple of the things that we're going to want to be aware of and keep in mind are that we're going to want to have some detailed action steps, and these are pretty standard things that you would want to keep in mind when you're looking to implement something. We're going to have, of course, the start date. Well, we should have already started, so we definitely want to start today or tomorrow if you haven't already. And then the estimated end date. I would still stick with the 10/1 of 2013, despite the fact we may have a grace period or some time in there. We don't know how much time that will be, so we want to make sure that we are sticking with that. You want to have someone take ownership over this and be the task owner, even if they're the one who is going to be creating the timeline and keeping people accountable. You want to nominate that person. The estimated time to complete each task, and we'll talk about that as well, and then the resources that are needed. And David has already touched on some of those, so we're just going to expand those a little bit. And with that being said, this is assuming that you, as the person who's listening today, or the person that your boss may walk into your office and say, you have now been chosen as the lucky person to be the project manager for ICD-10 implementation. But it can be a great learning opportunity and a growth opportunity as well. So know that there are lots of tools out there, and I know that Marilyn has provided you with several today, and there are some others that we'll talk about as well. So as David had already talked about, I'm just going to allude just a little bit more on what the other things are that we're going to want to talk about. So of course we're going to want to give our providers a high-level overview of ICD-10. You do not want to have this an all-day seminar. You want to have it short, brief, concise as possible. And then also let them know what their role is going to be. And you really want to get a champion, if you can, who buys into it and understands what the implications can be if you don't get ICD-10 preparedness done. You want to make sure that you're working on this. And it's going to be also important that it's based upon your understanding of the physician. You can estimate how much work this will take, and the time frame is going to be a few hours to be able to put this together. And you may be able to find something out on the AHIMA website or the AMA website as well when we're talking about the communication. We also want to build the awareness within the office staff. We don't want them to just think, oh, it's just the vendor, they'll handle it, or it's just going to impact the doctors or the coders or whomever. So we want to make sure that everyone is aware of this and what their role is going to be within this. This is going to be a time frame of one staff meeting, an hour prep, or an hour presentation, we say, is about the best time. And then the preparation that you as the stakeholder and the key player there is going to be able to do this. And you're going to want to introduce the different folks and the different roles that they're going to take on as well. Then we also want to be giving periodic updates. I would ask to be on the agenda for your monthly staff meeting or whatever it is, and then let them know each month what progress you've made and as things go. And then the closer we get to ICD-10, the more important that is going to be. And as David spoke about, and I will be touching on as well, that education, when it gets closer, we're going to want to make sure that our staff is educated as well. So this is going to be an ongoing thing that we'll want to do. Then in developing our strategy here, we're going to want to assess the knowledge and the skills that are necessary for the project. Who's going to be impacted by ICD-10? So who within their duties is going to be impacted? Who can we get to buy in and assist us with this as well. And then we're also going to want to have some level of involvement for the senior management as well. And then we want to get a commitment from the team as well to communicate the scope of work that's expected and the reporting responsibility. Again, meeting those timelines and making sure that folks are held accountable. This is going to take about 1 month here. Then we want to create an overview of the ICD-10 impact. As David had said, we want to assess who's using ICD-9 and then who will be using ICD-10. Who do we need to train? What do we need to be updating? What's going to be the impact to the EHR adoption, the pay for performance, all of those different things as well. And I want to say here that the overview of who could be impacted. The American Academy of Professional Coders, the AAPC, has a great sheet out on their website that you can download, and it's called ICD-10 Provider Office Changes. And it's a great mock-up of the different offices in the physician practice and the different impacts it's going to have on them. And I can send that link to Marilyn as well and have her load that link for you as well. It's just a nice overview of the places like the lab and things like that that we forget. So we want to plan a team meeting to discuss the scope and create initial work plans to be able to get folks, again, to buy in. We want to be able to have purpose, our scope, you know, looking at things, how are we going to move forward with this? And then talking about the communication. Are we going to put out a monthly email to all of the staff, especially if we're in a variety of locations? Are we going to look at our budget? You know, what's the impact there? As David was talking about it, communication is going to be key here. And this would be looking at about 2 months to be able to pull this together. Now, looking at the system impact here, we want to just be aware of these different things, because sometimes we forget about these folks who are at the front desk. What's going to be the workflow for them? And the scheduling system, will the code updates be required? Will they be automatically done? How will all of these be occurring? And as David was saying, some of our systems and our payers may need to have both ICD-9 and ICD-10, so that's going to be an impact as well. The ABN software, when will we need to be doing those updates? And the time frame here is about 3 months to evaluate and then 6 months to be able to complete those system updates and the CCI edits and all of those different things that we're going to see. Now, looking at our super bills, I know that a lot of people have said, oh my word, there's no way that we can possibly get all of our diagnosis codes on one sheet and our cheat sheet or our super bill will go away. That may not be necessarily true, because it depends upon the different practices as to the codes that you're going to need. Now, do remember that ICD-10 is partially frozen from 10/1 of 2012. No new codes will be in place until after 10/1 of 2013. And as we have it right now, that's the date for ICD-10 to be fully implemented. Now, we're all aware that we could be having a grace period in there. We're just not sure here, but we want to kind of plan for worst case scenario here. And then the claim submissions, we want to be talking about the updates to the claim scrubbers, make sure that those are going to be in place as well. And again, this will also be 3 months to evaluate and 6 months for the system updates to be completed. Now, we're going to have some medical necessity edits here. Hopefully, the providers will be giving you less unspecified codes. There's going to be so much more detail that's available, and that's something that I think the hospitals are really focusing on. So your providers may be getting that education as being part of a hospital, and they may be required to attend that sort of education as well. Any medical policies, NCDs, I know serving on the CHIMA ICD-10 task force, we've already talked about some of the different payers that are already reviewing their national coverage determinations to see what coverage determinations have ICD-9 in them so that they can update them to ICD-10. So they are also incurring a cost there. And then compliance checking as well. These are things that are looking at medical necessity. They may store an ABN. It imports the charge master, reorders the primary code, all of those sorts of things. So it looks to see if there's a CCI edit, anything like that. So coding, this is where my passion lies. These are things that you'll want to be aware of. When we're talking about these, you can go ahead and order draft versions of ICD-10 now. I know some folks who are true coding geeks are already, they've got the books at home, they're reading them, and I think that is so sweet. You may need to maintain ICD-9 for some payers. I've heard that workers' comp, as we know historically, they've been at least a year behind. I've heard that they may not be using ICD-10 right away, and it may be there for a while where we have to actually dual code or something of that nature because of the grace period and different insurance companies. We just don't know what's going to happen, so stay tuned. We're all kind of in that unknown. The PQRS tools and the worksheets, of course, those will need to be updated, and then also the coding software. As David was saying, make sure you're getting that information from them. Make sure you're working with those software vendors and that they are on target for that as well, because oftentimes they service both hospitals and physician offices, and I know a lot of them have been very proactive about it as well. Clinical systems here, in our protocols, we may need to change those as well, looking at the diagnosis coding, the test ordering, looking at labs, radiology, those sorts of things. They may be hard-coded, and we may need to update those as well. Reminder systems, evaluating the usage of the diagnosis coding and the update, and the disease management systems. This is probably going to be more of the hospital side, but some it depends upon the clinic. Some physician practices definitely have these systems in place as well. So our reporting systems here, the quality reporting, if these are driven on diagnosis coding and it's being currently tracked and updated, I know some insurance companies, that's how they pay. Those will definitely need to be updated. And then registries within the state, different things like that. So we'll need to be in contact with them as well to see if they are going to be updating ICD-10. And then practice the financial reports, evaluating the use of diagnosis codes and the updates. And we're looking at a timeline of about 12 months here with this one. So training, I know that we had a question about where can we find training materials for ICD-10. You probably can't find a lot of the materials yet. You can download some of the books and so forth, but they do want you to get your education from certified trainers to ensure that you are interpreting the guidelines correctly. I know that we've talked about kind of doing a readiness assessment, and I would have to say we're encouraging everyone to make sure that you are already familiar with the ICD-9 guidelines, because the transition over to ICD-10 will be lessened significantly if you're familiar with that. And then you just want to be sure that you're getting quality education, and there's a lot of different ways that you can do it. I know that there's a lot of different companies out there, but remember, what you're going to want to do now for education is do that readiness assessment. Look at, do some, I know in the company that I work for, we've done assessments as to what our level of education is and our needs for education for anatomy and physiology, for instance, because ICD-10 is going to be so much more focused on the body systems and so forth. You're really going to want to focus on that now. Maybe your coders can go take some education at a community college or something, taking an AMP course or something of that nature. There's a lot of different contexts that you can take education in. And I know that in 2013, because the date is so far set for 10/1 of 2013. The education you would want to start having for your staff would be early next spring, maybe March, April, that sort of thing. Because again, you don't want to go too far out. You don't want to go any further than 6 to 9 months, because it's one of those things, if you don't use it, you're going to lose it. One more thing that you want to think about that I know we've been talking about from the ICD-10 task force perspective are contract coders. If you are anticipating, which everyone is, that your productivity is going to be less, you may want to start assessing that and not wait until the last moment. If you think you may need a part-time additional coder or something, I've heard everything up to 25% to 50%. Generally in the clinics, about 25% less productivity. So if it's something that you are already having trouble meeting payroll, you may want to go ahead and see if you can get a contract coder staffed for you when you're going to be looking at that late next year. You don't want to wait till the last moment, because we've already talked about the fact that a lot of folks are hiring contract coders, especially on the hospital side, and the folks that you may be left with may not be the high quality coders that you're looking for. In addition to the expense may be much greater at that point. So documentation improvement here, as David had said, you want to assess within your different clinics and the physician practices as to what the relevant chapters will be in ICD-9 and ICD-10, and how much that will, the differences in areas where the changes will most benefit your practice. For instance, faster reimbursement and being able to file those claims and get those paid more promptly as well. The next slide is talking about the project plan template. That's what I was referring to, and we will have the link to that out on the Colorado Medical Society website. We wanted to provide this to you. This is something that you want to go ahead and use and go ahead and get started on this. If you haven't already, go forth and prosper and definitely get started on this right away. And the more on the project plan, make sure you have one owner or co-owners the most, but we're really thinking one person should really own the process. Physician and practice owners can delegate, but must provide a champion, and they need to really be on board with this, and then the time and the resources, and they must be willing to kind of back up your budget as well. If you've implemented an EHR, you can fully understand the need for a champion. And the plan can be done as an Excel document, Word table, or any document with columns and rows, because what you're going to want to do are fill in those dates and that sort of accomplishment, and be able to flip through those things. Now, here are some resources that we wanted to provide you with, and as I have said several times, Marilyn will also have some additional resources for you. So don't hesitate to go out there and look up the resources as well. I do want to thank Linda Gillum and First Professional Services for the usage of some of their materials today. And we also wanted to tell you that if you do have questions and you want to send those in, if it's something that we have time to answer today, we certainly will. If not, as Marilyn had said, we'll go ahead and formulate the questions and the answers and provide those out to all of the attendees as well today. And now I'm going to go ahead and turn it back over to Marilyn. Thank you.
Thank you, Sandy. Hope everybody's seen our logo in the past. It's the Colorado ICD-10 Training Coalition. The Colorado Medical Society organized this coalition. We're a group of educators, consultants, physician and practice representatives such as the state and component medical societies, Colorado Medical Group Management Association, the Pikes Peak chapter of PACOM, and even the Denver Regional Office of the Centers for Medicare and Medicaid Services, or CMS, are part of the coalition. And we all share the same goal of wanting to ensure that the physician and the practice are prepared for the implementation. We are providing you with ICD-10 resources and training that is accessible to all physicians and their staff statewide, and we'll be doing that by an organized multimedia education campaign. Each month on the third Tuesday, a new program or resource will be made available to help you. The next program will be on Tuesday, March 20th at noon, and the topic is impact analysis. And we will be taking a closer look at how the conversion will touch every aspect of your practice. And the AAPC resource that Sandy mentioned, it's already on the Coalition website, and that will be an integral part of the next webinar. The Coalition has a Facebook page, and it's under Colorado ICD-10 Training Coalition. All of the recordings, slides, and resources are posted on this site, so visit us on Facebook. And we thank you for joining our presentation. And we will be looking to see if we have any questions. So I see a couple. One is, where can we find ICD-10 training materials? And there's lots of resources out on the website, and the actual training materials for your staff, I'm sure that there are some on the AAPC website, and I know that there are some in the AMA bookstore. Sandy, are you aware of any others?
I also would like to say that there are also training materials out on the HEMA website as well, the AHIMA, and there will be more to come the closer we get to it.
There was a question, if you are ready earlier than 10/13, how soon can you begin using ICD-10? Well, I think the reason we say don't start the intensive coding training too soon is because ICD-10, like any diagnosis code change, is date of service specific. So you can't begin using it until it's a date of service of 10/1/2013 or after. There are currently draft versions of the ICD-10 available for purchase, and I think we all encourage you to have at least one in your practice so you can get familiar with it. The Coalition website is actually Facebook at this time, and we will reevaluate that, but right now it is Facebook Colorado ICD-10 Training Coalition, and we will post the slides on Facebook next week. And I don't see any other questions at this time. Somebody asked about the question about Facebook. You do not have to be a member or join Facebook to take a look at the Coalition page. All right. Well, with that, I'd like to thank you all for joining us today.